8100 migraine. In this video by Deckplate, we will be discussing the medical compensation for the condition of migraine that a discharged veteran of U.S. military may be eligible for. With very frequent, completely prostrating, and prolonged attacks productive of severe economic inadaptability. 50% rating. Frequency and intensity. Very frequent means these migraines occur regularly, perhaps multiple times a week or even daily. Completely prostrating means the migraines are so severe that they incapacitate the individual, rendering them unable to function or carry out regular daily activities. Duration. Prolonged attacks indicates these migraines last a long time, potentially hours to days, further incapacitating the individual. Economic inadaptability. This phrase underscores the severe implications of such migraines on an individual's ability to work or sustain employment. Severe economic inadaptability means the person is often unable to maintain regular employment, leading to potential financial hardship. Implications of such migraines. Work. Holding down a regular job can be extremely difficult. This is not just about missing a day here or there. It's about potential long-term unemployment or underemployment, frequent job switches, or an inability to pursue career advancements. Social life. Such migraines can lead to social isolation, as individuals may have to cancel plans frequently or might avoid making them altogether. Daily tasks. Routine tasks such as grocery shopping, household chores, or even personal hygiene can be daunting and might be neglected during severe attacks. Mental health. Chronic pain, along with the social and economic implications of severe migraines, can lead to anxiety, depression, or feelings of helplessness. Medication overuse. Given the frequency and intensity of these migraines, there's a risk of overusing pain relief medication, which can lead to rebound headaches, further perpetuating the cycle. With characteristic prostrating attacks occurring on an average once a month over last several months. 30% rating. Characteristic prostrating attacks. The term prostrating refers to the severity of the migraine attack, indicating that the pain and associated symptoms are so intense that they incapacitate the individual. A person suffering from a prostrating migraine might find it challenging, if not impossible, to carry out regular daily activities and may need to lie down in a dark, quiet room. Occurrence. The pattern described, on average once a month over the last several months, indicates that these are episodic migraines. They're not chronic, which would imply 15 or more headache days a month, but they are recurrent and predictable in their frequency. Effects on daily life and well-being. Disruption to daily life. Even though these migraines occur episodically, their debilitating nature can disrupt plans, work commitments, and other essential daily activities during the attack. Anticipation anxiety. Knowing that a severely incapacitating migraine can strike approximately once a month may create a sense of dread or anxiety as the individual anticipates the next attack. Economic impact. Regularly missing work once a month can have economic implications, especially if sick leave is exhausted or if the person's job requires consistent attendance. Social life. Social engagements might be canceled or avoided around the anticipated time of a migraine, leading to feelings of isolation or a decreased quality of social life. Mental health. The pain and the disruption caused by these migraines can lead to feelings of frustration, depression, or helplessness. With characteristic prostrating attacks averaging 1 and 2 months over last several months. 10% rating. Characteristic prostrating attacks. The term prostrating underscores the debilitating nature of these migraines. An individual experiencing a prostrating migraine attack finds it severely incapacitating, often rendering them unable to engage in regular activities. Such a person might need to retreat to a dark, quiet room, lying down until the migraine subsides. Occurrence. Averaging 1 and 2 months over the last several months, signifies these migraines are episodic but are relatively infrequent. While not as frequent as weekly or monthly migraines, the predictability and recurrence of these episodes can still significantly disrupt an individual's life. Effects on daily life and well-being. Disruption to daily life. The episodic nature means that while these severe migraines might not occur often, when they do, they can cause significant interruptions to plans, work, or other day-to-day commitments. Anticipation anxiety. Even with their infrequent occurrence, the debilitating nature of these migraines can lead to a sense of apprehension or anxiety especially if there's a pattern or a known trigger that the individual recognizes. Economic impact. Depending on the individual's job and responsibilities, having to take a day off every 2 months can have economic and professional implications. Social life. Even though they're relatively infrequent, the severity of these attacks might result in canceled or avoided social engagements around the time of the anticipated migraine. Mental health. Beyond the immediate pain, recurrent migraines can contribute to feelings of frustration, depression, or helplessness, especially if the individual feels they lack control over their attacks. With less frequent attacks. 0% rating. What are the symptoms of migraines? The primary symptom of migraine is a headache. Pain is sometimes described as pounding or throbbing. It can begin as a dull ache that develops into pulsing pain that is mild, moderate, or severe. If left untreated, your headache pain will become moderate to severe. Pain can shift from one side of your head to the other, or it can affect the front of your head, the back of your head, or feel like it's affecting your whole head. Some people feel pain around their eye or temple, and sometimes in their face, sinuses, jaw, or neck. Other symptoms of migraine headaches include sensitivity to light, noise and odors, nausea and vomiting, upset stomach, and abdominal pain, loss of appetite, feeling very warm, sweating, or cold, pale skin color, pallor, feeling tired, dizziness and blurred vision, tender scalp, diarrhea, rare, fever, rare. Most migraines last about 4 hours, although severe ones can last much longer. Each phase of the migraine attack can come with different symptoms. Prodrome symptoms: problems concentrating, irritability and/or depression, difficulty speaking and reading, difficulty sleeping, yawning, nausea, fatigue, sensitivity to light and sound, food cravings, increased urination, muscle stiffness, aura symptoms, numbness and tingling, visual disturbances. You might be seeing the world as if through a kaleidoscope, have blurry spots or see sparkles or lines, temporary loss of sight, weakness on one side of the body, speech changes, headache symptoms, neck pain, stiffness, depression, giddiness, and/or anxiety, sensitivity to light, smell, and sound, nasal congestion, insomnia, nausea and vomiting, postdrome symptoms, inability to concentrate, depressed mood, fatigue, lack of comprehension, euphoric mood. Diagnosing headaches. Your doctor will take a full medical history to help diagnose your headaches. This is the first and often the most important part of headache diagnosis. They will ask questions about the type of headache pain you experience, including frequency, severity, location, diagnosing the type of headache. The crucial distinction we make when diagnosing a headache is determining whether it is a primary headache or a secondary headache. Primary headaches, the most common type of headaches, are painful, but not dangerous. A primary headache is not a symptom of an underlying disease or condition. For primary headaches, headache trigger trackers and headache diaries can be effective tools to help diagnose the cause of your headaches. Secondary headaches are characterized by excruciating pain, usually caused by another, more serious condition. Headache diagnosis. Advanced diagnosis techniques. In addition to medical history, your doctor may use advanced diagnostic techniques to identify your headache pain. These tests are especially effective in helping to diagnose secondary headache pain. This may include erythrocyte sedimentation rate, ESARA, a blood test that can detect inflammation, MRI, CT scan, digital subtraction angiography, a minimally invasive test that uses X-ray and iodine contrast to produce picture of blood vessels in the brain spinal tap, to determine bleeding in the brain or the presence of bacterial or fungal. How to prepare for a doctor appointment to discuss potential migraine symptoms. Whether you make an appointment to see a neurologist or your primary care doctor, it's important to be prepared to give as many details as you can about your headaches and other symptoms. Make a complete list of your symptoms, including those that precede or follow a headache. Be sure to note whether you have nausea or sensitivity to light, sound, smell, or touch. But don't leave out other symptoms because you think they're unrelated. Pay attention to what your headache feels like, what kind of pain you're experiencing, and where the pain is located. Note when your symptoms occur and how long they last. Note anything that relieves your symptoms. Tell your doctor whether you've noticed any patterns in your attacks, such as occurrence after a weather change, lack of sleep, or when you consume certain foods or drinks. Tell your doctor if you have fatigue and/or weakness after your attacks. Use an app like Migraine Buddy to track your headaches